but allowing your child to suck on a pacifier for extended periods of time it might help to console your child, but it does cause greater harm in the long run. Once your child will begin teething, you should, at that point, once they begin teething is when you should try to really reduce the pacifier uses to only an as-needed basis. Because sucking continuously on a pacifier or a bottle can lead to tooth misalignment, so they might come in wrong because of all those sucking forces, if you can kind of picture that.
Their thumbs too.
Yeah. Now they might develop, from sucking all the time, they might develop an open bite, a cross bite, or like even a narrower occlusion, which will cause like crowding. And this can happen from the constant sucking forces while the child's teeth are erupting. Additionally, allowing your child to sip all day on anything besides water will cause harm in the long run.
These are those examples.
So sipping on juices or soda will continuously shower their teeth in a sugary and acidic environment, which is the ideal environment for cavities to develop, that's what this is. It's early childhood cavity. Another thing is sending your child to bed with a bottle should be strictly avoided. This allows the liquids to pool up around the bottom of their mouth. I'm sure you guys have seen when your baby will stop sucking on the bottle. You know they have a little bit of stuff in there when they fall asleep. It's natural when they're super young, but you don't want the liquid to pool overnight. This will bathe the teeth in that juice. Children who are sent to bed with bottles develop cavities at an extremely frequent rate compared to those who don't sip in bed. If you were to fill it up with 8 ounces of soda, this is how much sugar would be in each bottle. And so it's really, there's another gnarly
Juice is pretty bad too.
It just looks, I just think this one looks so gross.
That's a lot of sugar.
So you really, yeah, it's not the end of the world if you do it with meals, because then they're chewing other foods and you're salivating more when you're eating, so it flushes it out better, and it's not just a continuous shower. So
Myself and Tulu, we're going to cover diet and cariogenic diet. Paige and Mary kind of just talked about that a little bit. So I'm going to talk about why you don't want those things for your baby. How does your diet affect your mouth? So the thing is your saliva is at a neutral pH. You guys learned about pHs, right? So a low pH is going to be something that's super acidic, whereas a higher pH is going to be something that's more basic. So you want to stick to neutral and something that has a higher pH. It's not like everything that you eat and drink it's going to tell you the pH on it, right? So think sugars, things that are high in sugars and carbohydrates. Those are going to be things that are more acidic. So the reason why you don't want this is when you have a diet that's high in acidic things like, orange juice has a lot of sugar, soda has a lot of sugar, and then a lot of people don't think about fruits. Fruits are also put in the same category. It has a lot of natural sugars. Different things that you can do, first of all this acidity is going to cause more bacteria in your mouth. Bacteria is going to start breaking down your tooth structure. This is called caries. That's the dental term for it. You guys may know it as cavities. And these are decayed sections of your teeth. It can also cause your gums to be inflamed and cause gingivitis, something that Brittany and Jen talked about earlier. And then if left untreated, can cause perio disease, which this is going to cause recession, which is your gum tissue receding. That can never be regained. So I don't know if any of you ladies have it right now, but recession, once your gum tissue starts to go down and your root surface shows on your tooth, I explain it to people like your enamel is kind of like a tile floor or a wood floor. Your root surface is more of like a carpet, right? So it's easier to clean things off of, flat surface versus something that's going to get those grooves. Once that starts to happen, it's a lot easier for your tooth to then become compromised by the bacteria. So another thing is when you consume acidic foods and beverages frequently, you're consistently bathing your teeth in this acid. Other things that you can do along with eating and drinking it together at a meal is, you know, ending your meal with a fat or a protein. So something like yogurt or chicken or nuts. This is going to help get your mouth back to that basic versus the acidic pH. So this is going to inhibit the bacteria from forming.
Okay, well, one important thing that we don't, most people don't know about is that your saliva is actually really important. So it's really good to keep hydrated. Like Danielle said, yeah, our saliva has trace amounts of fluorides, calcium, and phosphorus, which helps remineralize the tooth structure. Basically, it neutralizes the acid in your mouth, so your teeth stays healthy. Frequency is one of the most important contributors to developing cavities. So you know how you're just sitting by the TV drinking soda. That's actually really bad for your teeth. What is recommended is to actually drink large amounts of it at a time. That way it reduces the acid that you're soaking your teeth in. So think about that.
So drink it all at one time.
Drink it all one time,
Yeah.
or like drink
So
like
go,
most of it.
go.
Yeah.
So
So
be done with it.
no straw then?
Just drink
Yeah. I mean, straws is good too.
The thing is the time. Don't let your soda last like 3 hours.
Yeah.
So
Like
drink
if
it like
Like sipping.
Yeah,
Yeah,
you know,
yeah.
every time you sip it, you're just touching the acid or the sugars in your teeth. Other things you think about is, yeah, after you're drinking a soda or juice, you can think about eating something high in calcium, like milk, yogurt, cheese, nuts, or meats, because that helps neutralize the acid in the mouth.
Alright, me and Hannah are going to talk about preventative care to prevent decay. The most important step in preventative care is going to the dentist regularly. There are many benefits of seeing a dentist every 6 months. Something is just to clean your teeth, but the services provided during regular cleanings are for preventative measures. So why go to the dentist after something like a cavity has occurred when you can avoid it altogether? And then some people are unsure when their child's first dental exam should be. So children who go to their first preventative dental visit by age 1 are less likely to have restorative work, and their average dental related costs are 40% lesser over 5 years than a child who goes after they are 1 year old. And then, so one of the preventative measures that we offer is fluoride. And we like to call fluoride like vitamins for your teeth. Strengthens the enamel, prevents decay. So, like one of the most common ways you guys probably get fluoride is through tap water. So it said for every $1 invested, $38 in dental treatment costs are saved. So fluoride is not only cost effective, but it is great for preventing decay. Orange up here, and it's
Just to show you how easy it is, because we do it at the clinic at school, and it's literally just this little brush with some
dip it
gunk
in
in
here.
the.
Don't get some
Yeah.
fluoride.
It's fluoride.
Yeah.
It's kind of sticky.
Yeah.
Like it sticks to the surface of your teeth, and all we do is we just paint it on your teeth, and then it sits on your teeth overnight. Yeah, it's kind of a new thing. Instead of doing the foam.
You can't eat hard.
can't eat after.
Hard stuff you kind of want to avoid just because it'll chip off your teeth.
yeah, you can
And
eat
hot
and drink.
drinks. But we say you can eat and drink. Just try not to eat
Right.
bacteria right after. You know, like sitting, so it's kind of.
And then some other ways you can get fluoride is from toothpaste and mouthwash.
Which you guys have in your bag.
Yeah.
So another thing, guys, is xylitol. It's I'm Hannah, by the way. Sorry. Xylitol is another. It's a sweetener, and it's not an artificial sweetener. It's a natural sweetener that actually is proven to reduce the bacteria in your mouth that causes cavities, which is huge. There's research on it. It's really interesting. But like these little candies, I only have so many because I collected them at a show that I went to. But if you guys want to break them open and try them, I'm totally fine with that. But they're really tasty. And it, like I said, it reduces the plaque and bacteria, so it keeps periodontal disease and cavities away, which are huge. And Spry's that brand, they have 100% xylitol sweetened products, which almost nobody has. Trident is a kind of gum, I'm sure you guys have seen Trident, that has xylitol in it. It's not as much, but it has it and still reduces plaque. So those are some good products that way. Lastly, in our clinic at Madison College, we provide sealants, which is at an extremely reduced cost of only $10 a tooth. They're usually 5 times that much, at least. A sealant is just a material that we put in the pits and the grooves in your biting surfaces of your teeth. So that's where all those bacteria and the plaque like to hang out. And when they're hanging out in those hard to reach spots, they sit there forever, and that's how you get cavities, because they're reproducing. All those bacteria reproduce and create acid. So by filling these hard to reach places, you can prevent sugar and bacteria from eating away at the tooth. And sealants are known to avert tooth decay over an average of 5 to 7 years. So it's a huge preventative measure. So all these measures that we have information on those laminated sheets that you guys can call our clinic. We provide free kids days, and you can bring in your child, which is awesome. And the sealants, like I said, are huge. So